Ready, right-handed, jog it down to the cone. Concussions in young athletes actually have more detrimental effects than they do us as mature adults. As a result of that, we really need to make everybody aware. Follow your ball.
Ball! Really?
The Massachusetts ruling was excellent in the fact that it brought together the trainers, the coaches, the parents, and the kids themselves so that all of us are together in understanding the importance of what to do when you have a concussion. Once that ball is picked up, try to knock that ball out of their stick. Let's go. The ball.
Oh.
If a child is playing a sports like my lacrosse players here, and they've had a head event and they come off and they have a headache, it's important to recognize you have to listen to that because the effects of a concussion go far beyond what's actually happening in their heads. You know, we know that a lot of the studies that we get from these kids usually don't show anything. But what they do show is problems at school, problems at home, problems with concentrating, doing their homework. All of these have effects on their lives. So what we're trying to do is make people aware that it's just not a ding. It's making them aware that this could be something that affects them for the next day and a number of days afterwards. There's no good answers to what a concussion is. As a parent, what you need to do is, first of all, you need to take it seriously and ask them the appropriate questions. Make sure that there's not been any change in their personality, change in what they're doing. Kids with concussions oftentimes have personality changes. They can be anxious, they can be sleepy. There's, kids that are out of character, have the parents evaluate that. Coaches during a game, it's important that if they have symptoms or you go up and you ask them, is to pull them out. Allow them to sit out and see how they feel. And if it looks like they've had a head injury or they have symptomatology of difficulty seeing, the light is more bright than it should be, difficulty to remember where they are, that they're evaluated, and they're evaluated professionally. I've never felt or heard criticism from somebody overreacting about it. The problem with concussions is us underreacting about it. Oh, he'll suck it up, it's another one of these injuries. So I think you need to take that seriously. I think you need to follow your child at home and see how they do. And if you're worried at all, take them to a professional where they can be evaluated. Especially if symptoms get worse, such as they get nauseous, they begin to vomit, they don't want to eat, they forget what they're doing, they're trying to study and they can't concentrate. Little things like that can mean an awful lot of what's going on, especially in the developing mind.